Medicare Part A is commonly referred to as hospital insurance. It's the first component of traditional Medicare. It's funded and administered by the Centers for Medicare and Medicaid Services, or CMS. Enrollees do not pay premiums for Part A coverage, but they may be subject to other out-of-pocket costs, like copays. Now, we call Part A hospital insurance, but in reality, it covers all the inpatient services you see listed here, like skilled nursing facility care and home health services. So how does it work? Providers that bill Medicare for Part A services are reimbursed on a fee-for-service basis. This means that for each service they deliver, they're offered a payment. So for example, a Medicare patient comes in for surgery and stays overnight or for a few days. The hospital documents the patient's condition and the care they received. That corresponds with a diagnosis code. And after the patient is discharged, the hospital submits a claim to Medicare with the diagnosis codes. Each code corresponds with a dollar amount that Medicare will pay the provider, and those dollar amounts get updated each year. In general, more resource-intensive care gets relatively higher payments. Now, Part A reimbursement makes up a significant portion of providers' total inpatient revenue, and that is in turn a pretty big piece of their overall total revenue. So, as more Americans age into Medicare, funding this insurance program costs the government a lot of money. Right now, Medicare expenditures are growing at such a fast rate that the program will run out of money in about 10 years. Because of this, CMS is rethinking how they reimburse providers for care. Over the last few years, in fact, CMS has started to move away from this purely fee-for-service system that incentivizes providers to deliver more and more costly inpatient care, and they're moving toward a value-based care system that rewards providers for delivering high-quality, cost-efficient care. CMS has implemented several programs that adjust providers' Part A reimbursement based on their ability to meet certain cost and quality benchmarks. If providers don't meet these benchmarks, they're going to get less money from Medicare than they have in the past. So we see providers doing three things to get the most out of their Part A reimbursement. First, they focus on improving performance across key quality metrics like infection rates and readmission rates. Second, they ensure accurate and timely documentation to make sure they're getting paid the appropriate amount for each service they deliver. And third, they're looking for opportunities to reduce unnecessary spending and deliver more cost-efficient care across episodes.